Crime across the country is putting an even bigger burden on hospitals, particularly when it comes to staffing issues.
Fox Business Network's Lydia Hugh reports on what some hospitals are doing to help combat the problem.
A violence prevention program here at the Jacoby Medical Center in the Bronx, New York, is cutting down on injuries from violent crime. Every person who's a victim of violent crime here is seen by a social worker who helps mediate the conflict that brought them to the hospital. A social worker also follows up with them after they're discharged, and the hospital says the program is effective. It has reduced gunshot wounds by 59% in areas they serve compared to areas that they do not, and decreased the rate of re-injury in patients also by 59%. Still, the hospital says it's seeing 120% more victims of violent crime in 2021 and 22 than it did in the 2 years before.
It's really been a little bit overwhelming, and I think it is tough on the day-to-day. That has a lasting effect on physicians in the emergency room, on the inpatient service, and in the ICUs.
Hospitals across the country are overwhelmed. In Aurora, Colorado, where murders, aggravated assaults, and robberies are at an all-time high, frontline workers at UC Health say they are seeing a, quote, noticeable and alarming increase in violent crime-related injuries. In Seattle, Washington, shooting deaths increased by 23% last year, and the trauma center at Harborview Medical Center expects to see its busiest year this year in the last 12. Officials are noting the strain on their hospital staff as the nursing shortage in the country is projected to reach between 200 and 450,000 within the next 2 years. Some now say that repairing the healthcare system goes hand in hand with addressing growing violence. Reporting from the Bronx, New York, Lydia Hu.